that you work with trans kids and teens, and I would love for you to share with people like a little window into what the process is like when a family comes to you. When kids realize they're trans, like what are they looking for when they meet with you?
I think it's important for me to note that there isn't one presentation that, that non-binary or transgender children or adolescents like present with. It can really be a range. I mean, there are young people that come in with their parents that, have a really strong sense of self and identity and can be very directive with healthcare providers about what they're looking for and what they want. And then there can be other children or young adolescents or even older adolescents that can come in a little unsure of what they want or even perhaps of their identity and are looking for not a bit of guidance in terms of what their identity is, but guidance as to the process. They may have questions about timing. They may have questions about the nuances of the medical interventions. They may not have any knowledge of what the medical interventions are. So, I think we try to provide like a one-stop shopping model where young people can come in with their families and access a full range of different types of services, recognizing that oftentimes it's not one thing that leads them to like pick up the phone and call a provider and make an appointment, and so it could be that they're having problems at home or at school. It could be that they have very specific questions about medical care, medical interventions. But I've learned over the years to like try not to anticipate like what the questions are going to be of the people that walk through my door and just really be open to sort of hearing each person's individual story as authentic and as important.
Is this a risky process for a young person?
Yeah, I mean, the answer to that is largely no and yes, so there are things that we do not know about the process, but, these are medical interventions that have been used for a long time now. They've been done quite safely. The medical interventions themselves are not rocket science. I mean, these are medications that we've used in other conditions for many years that have a really strong evidence base. And so I really want to be clear that I believe these medicines can and are used safely. I know for a fact that the teams that are out there that are doing this work do it with a lot of care and thought and precision. And so, yes, I mean, there's not a full range of evidence to support the treatments that we're using, but there is a lot of anecdotal evidence to support it. And the safety data that's coming out really suggests that these treatments can be used both safely and appropriately. And I think the other thing that I try to teach with my patients is that, it's also risky to not move forward with treatment. A lot of parents will come in and really think about like, well, is it safe for me to move forward, like with my child with some of these interventions? And I often, turn it on them in a safe way, but to say like, well, would it be safe for you to not decide to allow your, child to live their life as their authentic selves? And so, the decisions that these parents make, and I consider these parents heroes that really come in with their children, because they really are, in many ways, unsung heroes in this fight for equality for these young people. And they are making decisions with imprecise science, but oftentimes I think it is important to frame it as, that it's an active decision either way, whether you decide to move forward with medical interventions or whether you decide not. And I do think that there oftentimes is not as much risk in allowing your child to really live their lives as their authentic self.
What are some of the most common concerns that you hear from parents and young people when they come to you and sort of are asking questions, and what are they looking for?
Yeah, I mean, most of the young people that come in are wanting to figure out like how fast they can get on hormones and what's the safest process to do that. I mean, I would say 80% of the young people that come are often really activist in their mindset and come dragging their parents to the medical visit, where like, a lot of the time these young people know what they want and they are trying to move the process along as fast as possible. and the counterweight to that is the parents who are often coming in with questions about how can this be done safely? Is this really the right decision? And so it's really a bit of a puzzle to put the pieces together to make sure that you're, meeting the patient's needs, but also like moving the parents along in sort of a, not always a linear manner, but in a way that continues to get them educated so that they feel comfortable, with the decisions that they're about to make. Because the truth is that these young people need their parents' support to be well and to do this well. And so it's our job as pediatricians to make sure that the entire family unit in some ways, hopefully, like moves forward in an ideal situation in a way that feels supportive and nurturing. So it's usually the young person comes in knowing exactly what they want and us trying to navigate a process of having that done safely and really allaying parents' fears. I mean, sometimes parents will come in and be like, what is I want to make sure that my young person is, that my child's really trans, can you help me with that? And I'll turn to the child and be like, yeah, so, what gender identity do you have? There's no form, there's no scale, there's no psychological battery of tests that needs to be done. Really, the young person can answer that question for themselves. And sometimes that's news, I think, to parents, that, think that they're going to come in and have this evaluation that is going to help determine their child's gender identity, when really our work sometimes is just getting them to recognize that anyone's gender identity, be it trans or otherwise, is a normal variation, and it's not an affectation. It's just a normal part of the human condition.